I'm Shannon Weber with Hive, a hub of positive sexual and reproductive health, and we are here in Keystone, Colorado at the Sexual Health Conference. It's July 2015. Do you want to introduce yourself?
Sure. My name's Corey Bloom. I am a family physician and the medical director for HIV at the Chicago Department of Public Health.
And we met really around this interest around reproductive and sexual health with someone being affected by HIV. And then out of that, this idea of how do people build families. And you've really done some amazing pioneering work in Chicago along with your coalition. I'm forgetting the name now.
The coalition is called the HIV Sexual and Reproductive Health Coalition.
Right, around what does it look like to have family building for all types of people living with HIV. So I wanted to ask you about your story and how did this get on your radar, first of all? I think we all have a story about what hooked us in and we realized we needed to change.
Right, sure. So my background is really I thought, in women's health and also in HIV. And so when I started practicing and being a primary care physician for people living with HIV in Chicago, I started becoming a provider for men. So my shift of care shifted a lot from women to men, which was a surprise to me, but it has really expanded my knowledge and interest. So a couple of young men who I've worked with starting maybe 6 or 7 years ago started having conversations with me and expressing that they were interested in having babies or building families. And these were young gay identified African American men who I wouldn't necessarily have thought at the time, oh, I need to be talking to these young men about family planning, but they brought these issues to me.
It's so beautiful. It talks a lot about you, their trust of you too, because I think people say it's hard to bring that up with their provider.
Yeah, well, I'm glad that I could make the space for that to happen. So one of these young men was talking about how he was interested in having a baby and very interested and excited to learn that that would be possible, even though he was living with HIV. And he was talking about how he would be reaching out and meeting women partners potentially to have a baby with. And I connected him actually with Caroline Watson at Hive, because I knew that the work that you were doing with Pro Men in San Francisco was sort of up his alley. And he was really excited to have that connection. So he's still working on finding a partner and being able to have a baby. And then there's another young man who is, I met him and he was about 22, 23 years old, and he'd been doing great work in HIV education at his college. And he was dating men, and since then he's become married, and they've done the exploration with an adoption agency. They've signed up and they're doing interviews, and they're like getting to the process of actually having their own baby. So it's really exciting.
It is. So these stories, I think, change us, and I'm curious when that happened for you. How did it then change your practice?
So for me, I think hearing these stories opened my eyes and really got me thinking about, wow, people of all, genders and HIV statuses and living situations and ages really, I feel like, need to be able to understand this opportunity to build family and to feel like that's a possibility for them. So it's changed my practice in that I have more conversations with people about what their intentions are or what their interests are, and whether their interest in having children is, oh, no way, I'm never gonna
Which is
be a
also
parent.
good info.
Right, good
That's
to know.
great info.
Yeah. Or oh, you mean I can have babies even though I'm living with HIV? That's a really exciting moment to provide information and help people understand more about what's possible.
How do you think it's changed your relationships with patients?
Oh, it's definitely made us closer. I think more trust. I also feel like in my own practice, during this time, so around the same time, about 6 years ago, I was pregnant myself, and so with my patients sort of lived through that pregnancy with me. So they ask about my kid, and they call her my baby, and how she's doing, and it feels like we are more like family. I can ask them about their family and how things are going.
You guys have a shared experience then.
We do, yeah.
So I think there's a lot of providers who want to be able to do this, and it feels challenging. Maybe they think, I don't know where to refer people, I don't know all that information, but do you have a suggestion, I guess, about what's an easy way to at least start a conversation, even when because you did this, you didn't know all the answers,
Mm-hmm.
but it's like starting down that path with somebody. So what's a simple way or tip
Mm-hmm.
that you have that people could practice?
Yeah. I think as part of the initial getting to know someone, when you're starting that patient-provider relationship, that part of the sort of history-taking process, and whether this happens in the first visit or the second or third, is to say, so, something like, well, I'm interested to know how you feel about building a family or having children. Is that part of your intention? Tell me more about that. It's a pretty easy way to open the conversation, and and then you'll learn from the person what they're interested in, and then you'll know whether you have the resources or not. And if not, then to sort of reach out and find those resources. I'm sure they're everywhere. I feel like in the last few years, since I've been doing more of this work, that I've learned that there are lots of people all over the country who are really interested and dedicated to this work. And it's just a matter of seeking them and finding them.
The thing I love about that question is it would let me know that you were open to the conversation, because maybe I hadn't considered it before, or I have this, as a person living with HIV, I might think I'm not supposed to ask about that or want it. So even you asking that, if I don't have an answer now, I know I could come back to you, which I think is really valuable to have that place.
Great, yeah.
Awesome. Thank you for doing this.
You're
and thank you for
welcome.
all you do.
Thank you. Yeah, thanks.